And we are recording, so if you would like to start, we can do that.
Okay, so we'll call the meeting to order. I guess we're supposed to read the...
Yeah.
Is that right, Lauren? Okay, so pursuant to Governor Baker's March 12th, 2020 order, suspending certain provisions of the open meeting law, General Laws 30A, Section 20, and the Governor's March 15th, 2020 order imposing strict limitation on the number of people that can gather in one place. This meeting of the Gardner Board of Health will be conducted via remote participation and broadcast live on the city's YouTube channel. The audio and video recording, transcripts, or other comprehensive record of proceedings will be posted on the city's website as soon as possible after the meeting. First item on the agenda is the minutes from the June and July 2020 meetings for review.
I make a motion to accept. Do you want to do each of them separately or?
Yeah, why don't we, because actually I believe the June meeting, I was not present at that meeting. So I guess, yeah, if you want to make a motion on that one and open it up for discussion, we'll
Make a motion to accept the June minutes, meeting minutes.
I can second that.
Okay, any discussion on that? Everything looks good?
It looked good to me. What about you, Shelley?
Yeah, I think it's fine. I was just
Yeah.
reviewing it again. It's short and sweet, and I think it was fine.
Yeah.
Okay, so all in favor of approval of the June 29th, 2020 minutes? Susan?
Yes.
Dr. Parker?
Aye.
Okay, so approved. Now for the July 20th meeting, do we have a motion on that?
Make a motion to accept.
I'll second that.
Okay, any further discussion on that one?
No.
I looked it over. I think everything
Mhm.
seemed to be in order. Okay, so all in favor of approval of those minutes? Susan,
Yes.
Dr. Parker,
Aye.
and I approve as well. Okay, so the minutes for the June and July meetings have been accepted. And on to old business, I guess.
Okay, so I had Tina on the agenda. I know we had talked about doing tattoo regs if this agenda was not too packed, but I think that we have too much other stuff to really get into it. But there are a couple of things that I think should be discussed now. One thing, it's because, we gave the go ahead to kind of start doing observation hours at Main Street Tattoo, like so the breakdown and setup of the tattoo stations, as well as the observation hours. And I got some pushback from one of the apprentices about how it only takes about, 10, 15, maybe 20 minutes tops to observe a setup and a breakdown, like to do a setup and a breakdown. So it's not, so I think we had said originally like 50 hours for setup and breakdown, where I think that might be unrealistic if it only takes about 20 minutes to do so. So I kind of wanted to revisit that in this meeting and see if we could agree on a number, and Tina can give us more feedback on that because she did a little bit of research. And then the other thing tattoo related was, I know that we talked last meeting about how Quincy is no longer doing the skin course, the anatomy of the skin course. And we're just kind of looking for a replacement. So when people are coming and saying, oh, I have this course or I need this course, we need to know where to refer them. So Tina also did some research on it, and of course that may be comparable. Because the anatomy of the skin course is something that we allowed in lieu of the anatomy and physiology college level course. We've always allowed it. So we kind of just need a replacement if we're going to allow something other than anatomy and physiology. So Tina, if you want to just kind of touch base on those two things.
Yeah, so I did reach out to Ruth Jones, and she was kind enough to share with me her outline and slides and tests. And so I had a pretty good idea of what that course entails, which was very thorough about the skin. skin disease, diseases, things to look for, reactions from tattooing. And then I did look at the course that we're considering, which is a business called Save Each Life. The course, I believe, is out of Greenfield, and it's a company's been around for a while, since 2009. The teacher is not a medical person or a science person. They have an associate's degree in IT from like a school, I think, out in the Western Massachusetts. But they teach a lot of first aid classes, they teach bloodborne pathogens, babysitting, and then they offer this anatomy and physiology skin course specifically for body art practitioners. So this course is mainly online. They expect 4 to 6 hours of self-study before you go to the live class. And I looked at the outline. It does go through all of the body systems. It does cover, tattoo specific issues, disorders of the skin, diseases that could, cause complications with body art. So it does go into that, but the curriculum is basically self-study videos. He gives them like a workbook to read through, and then they go for a 4-hour live class, and then they take a test. I did reach out to the instructor, and he wouldn't share the test with me. He just kind of pointed me to the website and what the self-study outline looked like and the materials. And I did look through some of it. It was a lot of YouTube videos that covered, different body systems. The tattoo specific videos were just, people on YouTube talking about reactions to the different dyes, kind of showing what that looks like. Different types of, sensitive skin and how that can affect tattooing. So I think in terms of the tattoo specific subject, the Ruth Jones class probably was more thorough, but I think this course does kind of cover what you would want somebody to learn when they were going into an apprenticeship program. It makes me a little nervous that it's not a medical person or a science person that's teaching the class, but it does cover the things that we would want somebody to cover, instead of, the alternative is somebody taking a college class. And the one that I looked at was an online class. I think it was through the Mount, that was like 48 hours of course time. So
I think to take A&P, you need prereqs, right? You need like
Right.
or something.
I'm not sure with that class. I can look at it again for the board, but there was a class, I think it was a little more basic than your standard A&P that you would take, like if you were going to be a nurse or, go into, a health science.
Yeah, the Mount has an essentials of A&P, which is like a little bit less than the full A&P.
Yeah, that must have been what I looked at. It was an online version of that. I did go on, I observed an inspection with Dottie McNamara a few weeks ago in Fitchburg at a tattoo shop called Red House Irons. And I did speak with the owner there for a while, and his apprentice recently did take this course through Save Each Life. And the feedback I got was that the home study was good, was fine. They went to the class. It took them a few months to get into this class. They went to the class, and it wasn't very organized. They kind of said, well, if you want to go ahead and take the test, you can take the test and get out of here, kind of a thing. And so this person just kind of decided to take the test and get out of there. So I think that the Save Each Life curriculum is really the home study. I don't think there's a huge component. I think that if they wanted to sit and pick the brain of the instructor and ask questions, they definitely have the opportunity to do that. And I definitely think, we would want somebody to have, an ability to ask an instructor about questions and get feedback. So they would be able to do that, but the feedback that I got from Thomas at Red House Irons was that it was kind of like, oh, it checks the box. It checks the box, and that's, what they're using apparently in Fitchburg for their apprentices. So
They get like a certificate or something that they've successfully passed the.
they do. Yeah. Yeah. They have to get like a 38 out of 50 on their test in order to get the certificate of completion for the course.
Well, I don't know what else we could possibly use other than requiring the full, A&P or essentials of A&P. There's really not a whole lot else around here. So what are you guys' thoughts on it?
Do we know like the name of this company? Do they charge a lot of money for it? I mean, is it like a rip-off kind of thing as far as charging, an enormous amount of money?
That's a good question, and I don't remember what the price is, but I can look it up real quick and see.
I was just curious. I mean, if it's like a lot of money and it's not for the value.
Yeah. The problem that we have is that there's really not another option, like Lauren said. I mean, I looked and looked and looked. I went on like the Association of Tattoo Artists and, looked at different courses and tried to find different online or in person, and just didn't really find anything that was equivalent. And, you want something that's specific to body art practitioners.
Right,
You want them to talk about those specific issues. Look for this on the skin, or look for, and, this type of reaction can occur. So you need something that is specific to
and it is their baseline before they go into the apprenticeship. So they do have the time, the hours in the apprenticeship, which hopefully they'll learn more and more about it from whoever's apprenticing them. Is that the right term?
Yeah, I didn't know what that term was. Is it their mentor? Like, what is that?
Overseeing their apprenticeship.
Yeah.
So I don't see a price on here, so I'm not sure. I can't imagine that it's that expensive. So I feel like there's really not another great option, is kind of, or unless you wanted, to start doing more of a college, the different cities that I looked at for their body art regulations, they all kind of had an A&P, college level or something that's approved by they all kind of, give that option of the board approving a course that's not a full-fledged A&P class.
Thank you for doing all that research. It looks like you've done a lot of work on the regulations and the apprenticeship program. So thank you so much for doing that.
Oh, absolutely. I learned a lot, and I was surprised that there isn't a state regulation or, I was surprised that this area is not more regulated.
Up to the Board of Health, and we are not tattoo experts, unfortunately, and I wish there was more guidance, like with the microblading conversations and stuff too. It's like the wild west out there. She actually called today, the person who wants to microblade. I'm like, I still have no concrete guidance for you. She says, can I do an apprenticeship outside of town, because we kind of said she could apprentice with a tattoo artist because there's no microblade people, and I was like, yes, however, you have to get the Board of Health approval in that town. You can't just go rogue and start, you know what I mean? To start microblading in Leominster if the director doesn't know you're working there. We have to.
So let me, I need to understand a little more. So the apprentice in Gardner wants to do the microblading?
There's somebody in town that wants to do microblading. She's gone to a school and she wants to apprentice under someone, because we won't let her just go from school to full license to microblade on people's face. So we want her to have some type of apprenticeship hours, and there's no one for her to apprentice under. Like there's, I think, one microblading shop in like Leominster, but they're inundated. They don't want, because there's a bunch of people who want to learn this craft, and there's no one to apprentice under.
Oh, I see. Yeah.
that's
Did
the
you go to
dilemma.
that course in Boston, that prettyology or whatever it is? Like, that's the only one that's like certified or whatever in
Yeah,
all
she
of
took the course
Massachusetts.
out of state, and it's legit. She has all the paperwork. I think she has an A&P course, like, because she was in, I think, nursing school at one point. So she has everything. She just doesn't have someone to practice under at this time.
Oh, okay.
That's something we have to revisit when we have the full blown. I think we should schedule like a full meeting with nothing else other than tattoo. So, I mean, as far as this, do you guys want to vote to approve that course? Do you want more information? Where are you guys at?
Do we have a copy of the curriculum? I know you said that they gave you a website that had the curriculum. They wouldn't show you the test, but they showed you the curriculum, right?
Yeah, I do have the link and I can send it. Let me just send it to Lauren and she can send it to you guys. And I should have put that in my report and I didn't. But when I emailed him, he sent me, I'm going to forward this right now to Lauren, just a link to his outline, and it has a link then to all of the course materials. So it's basically what they are supposed to do to study prior to the live class.
And then they take this exam, and is there a certain passing score that they have to meet? I mean, how stringent is that?
Yes, yes. So they have to get an equivalent of a 75, basically, which I believe is like 38 over 50, 38 out of 50 questions to pass. But he didn't give me I would have loved to seen the exam to know exactly what, they're being tested on, but he wouldn't share that with me. Did you
I guess what
email?
I guess what worries me about those exams is that I've seen so many of these online courses where you can go through, 10, 12, 15 hours worth of videos to learn what they're trying to teach you, or you can go right to the exam. And almost every one I've seen, the average person can pass that exam with some basic knowledge in that area without even taking any of the course or watching any of the videos,
Mm-hmm.
I mean, I would imagine this would not be that extreme, but do you get the impression it's a possibility that somebody could just cruise through this thing without really learning anything? Or
I think it's possible if they have a baseline of knowledge, they could probably pass it. It's worrisome that they don't have somebody sitting in a classroom and showing them slides and saying, look at this skin. What is this? Like, what does this look like? Look at, and would you tattoo on this? And really talking through issues and problems that can occur. So, Lauren, did you get my email from him?
Yep, I got it. So I can forward it to you guys now. I can forward it to you guys later, and we can vote when we talk about all tattoo. What do you want to do?
I think I'd like to look at it. And it's not that I
yeah,
trust you, Tina. I really appreciate all the research you've done. I think that's incredible, but I feel like I need a little more information to make sure it's rigorous enough, even though, like you said, we can't see the test, but it'd be nice to know what the curriculum is and how involved they're educating through that course to know if we should approve the course. And just because there is a course, I can't say it's a good one, but if I see what they're teaching and measuring on, then that would help.
Right. No, I understand. Yeah, I mean, you can look at it. It's, basically there's a link. It gives you basic information for each body system. And then there's usually a few videos associated with each body system. And then at the end, it has a section for skin disorders, and it has a section for like tattoo, like body art specific issues. And there's information and videos with each of those. And, like I said, this isn't a medical person or a science-based person that's putting this all together. So that worries me. I haven't read through all of it, but that piece does kind of worry me too.
But there's no testing like after each module kind of thing, like some things that you go through, you are tested on the materials, kind of make sure that, like Jeff said, make sure that you read each section.
No, there's no module. There's no like, you know, how you can like, you can't go forward until you do like you, it does, you know, there's nothing that ensures that you're actually looking at everything.
Mhm.
All right, so I guess, you know, maybe you can get that information out to us, Lauren, and we'll take a look at it, and we'll be able to have a better idea whether we want to approve that, I guess.
Okay, sounds good. So then the other piece was, so this is something Tina put together. So her suggestion was to do, so instead of 50 hours of break preparation, workstation prep and takedown, she did 50 cycles, which mean they're about 20 minutes each. So she put 50 cycles, that was her suggestion, and that makes sense to me. And then she did for an edit 100 hours of direct observation. I wonder if we should just keep it at 50. I mean, they don't have a lot going on in that shop. So I don't know if we should do 100 hours of direct ob or if we should do 50 and then the 50 cycles of breakdown and setup.
Yeah, so when it was 50 hours originally, was there any basis for that in terms of how many cycles we thought that was, or I don't really recall even discussing.
We pulled out from another community's apprenticeship regs. It was kind of like the 50 hours of the direct ob and the 50 hours of the breakdown and setup in that first level for a total of 100. And then we went into level 2 where it was actually skin to skin contact, you know, direct skin contact. And then level 3 was a little more, you know, advanced pieces. So level 1 is really where everyone's pretty much still at, which is good because we haven't finalized these regs. So that's why I just wanted to take a minute to kind of get your feedback on that. Because I talked to Kevin and he's like, it will take me forever to do that many, you know, 50 hours of setup and takedown because it's only a 20-minute process. So
I think that 50 cycles makes a lot of sense. I guess I was wondering on the 100 hours I thought was already substantially reduced. Wasn't it from the original proposal that we had, or I thought
for that level, no. It was 50 hours of observation and then the 50 hours of the setup and takedown. So, and then we go into the 850 hours for level 1, like skin contact, and then 850 for the level 3. So I'm comfortable leaving at 50 hours of direct observation because that's still, I mean, that's a lot. That's many tattoos. If it's an hour tattoo, that's 50 tattoos that they're observing before they can even do skin contact. If it's a 4-hour tattoo, it's a little less, you know, but I think that's sufficient. And then I think the biggest thing is the skin, you know, the direct contact, the 850 and the 850. So that's 17 direct contact apprenticeship hours. And then it would just basically be the 50 hours direct observation and then the 50 cycles, however long that takes.
I think that sounds reasonable. To go with the 50 cycles and the 50 hours of direct observation. But I don't know that I would want to change the level to a level 3.
Yeah, I'm not really looking to get, I think those should stay as is. I just think that first level, I just think that was an issue,
So I have a question, Lauren. So would they do the 50 hours of observation before they would start doing the cycles, or would they be able to combine that? Like after they observed for a while, then they would start doing the workstation preparation and cleanup?
They could, I would say they could do them simultaneously because they'll have direction on how to set up. You know what I mean? They kind of learn by doing, like someone will obviously be there with them if they're setting up for someone else's tattoo. But they'll be there with the, you know, the tattoo artist setting up, taking down, and then they can observe the same tattoo, I would say, right?
Yeah. Sense. So how long do you think it would take them to get those 50 hours of observation completed in the traffic that they have in Gardner?
It depends. I mean, some people are doing, you know, 5 days a week apprenticeship in the afternoon. Some people probably are only in there 1 or 2 days. So this is, and I know in one of your notes I was reading was like, you know, some communities have a cap on like 2 years. I think this in Gardner could take, the whole apprenticeship could take 5 years. I mean, depending on how many hours they're putting in the shop or how much work there is to even observe.
I
you
see.
know, or having someone observe you, that takes up hours too for one of the artists. So I definitely want to make it challenging enough that it's safe, but I also think we need to keep in mind the volume and whatnot in Gardner. So.
And those, the draft regulations that you emailed over today, is that incorporating what we're talking about? And is it a complete rewrite of the one that we were reviewing a while back, or
So
is
we
it?
have, yeah, so Tina had kind of done a little work on the draft regs, which she kind of added some things in the regs. So the one I'm looking at now is the apprenticeship, the draft for apprenticeship.
Right, right.
Because we had like a supplemental document there. So she's made some edits in the one that we just sent over. So I think that that's
Right.
one we should review and then talk about at the meeting we schedule to really, you know, finalize this. And then there's the apprenticeship.
Yeah, I guess I was referring to the actual regs as well. Has that been reworked completely, or is that?
That's the one we were looking at before we started the conversation.
Okay.
It's definitely a rework of the original regs that were done in 1999. That's the one that we
Right,
kind of
right.
started looking at. Yeah.
Okay, so kind of where we left off with it.
Yeah.
Okay, so do we want to take this under advisement, and maybe we'll set a special meeting, I guess, for review of the regs, and maybe, you know, hopefully we can move towards passing something on this.
Sounds good with me.
Me too.
Over the curriculum things that pass along, and then these documents as well.
Okay.
Have a special meeting.
Okay, so should we go ahead and try to set a date for that meeting now, or I know we've been putting it off and tentatively throwing it onto the next agenda, and it seems like it's something we need to probably have a special meeting for.
Mhm.
Yeah, I could do one in 2 weeks if other people are open to that, rather than waiting a whole month. We could do another Monday like this is fine with me. If it works for you guys.
How about the 31st of August?
Okay.
Does that work for you, Jeff, Tina, Shelley?
Yeah, I can do 4:30 on that day.
It works for me as long as it's in the afternoon, because that's our first day of PD at the school district.
Ooh.
But I can do it in the afternoon.
So 4:30 would work for you, Tina?
I'm sorry, say that again, Lauren?
4:30 would be okay?
Yes, it would.
Okay. All right. No, Jeff?
I'll have to just confirm that. There was a chance we might be going away that weekend, but I think I'll be back. But yeah, let's tentatively set it for that date, and then if we had to move it, would the following week work for everybody, or?
The following is that Labor Day?
Monday.
Oh, it is.
The 7th is Labor Day.
Okay, I mean, it doesn't have to be a Monday, I guess, either, right?
No,
Fine if it's a different day. I just have to look at my schedule ahead. That's fine.
All right, well, let's put it on for the 31st at 4:30. And hopefully I can make that work.
Okay.
Yeah, you wouldn't want to miss out on this, Jeff.
no.
You are not allowed to miss the tattoo.
You're waiting a year for
I'll
this.
be down in Central Florida somewhere probably, and then I'll be quarantining for a couple of weeks until you get there.
You can quarantine at the tattoo meeting because
It's virtual.
all right.
That's true. I can't hide on the virtual meeting, I
No,
guess.
if you come back tan, we'll know.
All right, so do we have any other old business?
Just a
Lauren?
couple updates, like going off last month's agenda. So that we did on June 29th, we did the special meeting for the local upgrade approval for 89 Hill Street. And there was just something in there about, you know, making sure it was good with the Conservation Commission and everything was approved by Conservation Commission. So they're set to move forward and they started excavation last week. So I just wanted to update you on that. Last time we spoke, I mentioned that we were still trying to find the 19-hour person for our office who does part-time admin, part-time liquor license commission. And we did offer it to somebody. She accepted and she'll start at the end of this month. So that will be good.
Good.
Fully staffed, hopefully, knock on wood. And then the only other thing I wanted to touch base on that was in last month's agenda was flu clinic, which I know could be like a lengthy discussion. But I just, I was just thinking like, I know we should probably set something up. And Tina, I thought maybe like you would be a great person to talk to about maybe working on a flu clinic, but we were kind of talking about maybe partnering with other agencies, the schools, the hospital, the pharmacies, versus like doing our own. Like in the past, the Board of Health has put one on, but we've needed other partners because we obviously can't, fully put on a flu clinic. We don't do the insurance paperwork. We don't have nurses here in this office. So obviously it's something we want to look into. I don't know when do flu clinics usually happen? September, October, November? What's the big month for flu clinics?
Pharmacies have them already. Just in the last week,
Yeah.
having patients come in saying that they've gotten them. Someone just texted me that they got it today at Walgreens. So I think the shots are in, which is kind of early. Usually it's
It's early.
mid-August, but this started like a week ago. So they were in early August. So anytime now is good. The sooner the better. And so often we'll start doing them in the end of August or early September. But we only get the PD ones ourselves right now because they're supplied by the state and we're not billing for vaccines right at the moment. So we're just sending people to the pharmacies. But if the Board of Health does it and the pharmacy does it with you, it seems like they could handle all the billing and
Right. That's what I was thinking is that, if we just kind of collaborated and I would, when we were talking, Lauren and I the other day, just about thinking about contacting, someone from Haywood. They would know what the physician offices are doing, the groups as far as having clinics and all the pharmacies. And because there's no sense in duplicating what we're doing. I mean, we certainly can, I think the community's going to want to be more vigilant on wanting to have flu clinics, and they're going to be their flu shot, and they're going to be more concerned and, with everything with the pandemic. So like I said, I just thought it would, and yeah, we don't bill. So it would take so much for us to get into all that process of doing it, but the pharmacies already do it. So if we can just at least coordinate with them to know that they're going to cover all the, like the housing centers, the major, like Church Street and Banal House and that. I don't know if they do already or not. And I don't know, does Haywood have clinics or?
For employees, I know they do. They actually really vigorously get everybody immunized who works here, or else it used to be if you don't get immunized, you have to wear a mask, and now we're wearing a mask
Now
anyway.
you're wearing a mask anyway.
But nobody wanted to do that before, so we had really good immunization percentiles for employees. The individual clinics, I'm not sure how they're doing it. I can check with HAMG and see if they're, if HAMG's ordering vaccine for that. A lot of the private docs do, but there are a couple that don't.
Yeah.
The schools, I think, used to have a flu clinic. I don't know if because
Well, it used to be sponsored by the Board of Health, but we haven't been doing them the last couple of years. That's why I thought maybe if we could at least coordinate and gather the information, and we could put something on the TV station and maybe do try to get education out there early.
But for the kids to get them at school may be really helpful, because that's one barrier of trying to get parents to bring the kids to the pharmacy and get them done. I mean, we do kids here either as a scheduled walk-in, or if someone's got a physical, then we get them while they're here for the kids. But I think that could be a problem where, kids should be immunized so they're not bringing flu home as well. And getting them done at school is a pretty good strategy. But how hard would that be to set up this year, Sue? You think that would be?
I'm going to ask Tina, because Tina works at Gardner school system. So
Okay.
Yeah, I was going to say that the last few years we've had Rite Aid come in and do our staff at the schools.
Okay.
We haven't done students since I've been working in Gardner. And I think that we could probably organize something, but right now we're in remote education. So, and I don't know when we might have students in the buildings. We generally do our staff, I believe, in October, but it might be, sounds like it would be beneficial to do something early. But it seems to me like with our community, it would be great to have like a weekly like flu clinic or something where we could advertise it and say every Tuesday, Thursday or something, somewhere, and the school buildings would be a good place. Maybe we could even rotate it around so that it's in different areas of the city as well.
Maybe the different pharmacies might be willing to take one on, have a clinic, because they can do the billing and everything. We don't worry about storage.
I don't know if they do kids though. A lot of the pharmacists won't immunize kids. I can check on that because we've run into that problem before where if we get state supplied vaccine, we do it here. But if it's something we don't supply, the pharmacies can't do kids for whatever their cutoff. I don't know what their age cutoff is, but we can try and find that information.
How hard would it be for us to, or at least even have one family night clinic? We used to do the one in Waterford. So the kids could get done. I mean, I don't know how hard that would be to organize.
I don't think it would be hard at all. It would just be getting the information out to the families.
Getting the vaccine is the issue, We don't have storage. We don't have a refrigerator that works.
Well, I know Dr. Parker has one.
I know. I don't know if we can order it to at this point because we kind of have to pre-order what we need for our patients.
In the spring, yeah.
Yeah, but let me find out if there's any way, if we told the state what we're doing, if they could extend that and give us some extra ones to do school clinics. But I'd be willing to check on that. All right, so I'll check if the pharmacies have an age cutoff. I'll check if we can order more from the state, and I'll check with HAMG to see what they're doing. Those are the employed physician offices, and see what they're doing for their peds and family medicine.
Okay. Even if it's a matter of us helping to get the message out and coordinating, if we knew they're scheduled this, week, that week, and we try to get, concerted effort to communicate it to everybody. I just think that of all things right now, we need to just all be collaborating and not all of us duplicating the, message.
Yeah, we're going to be sending a lot of health information to the families for the district. So this obviously could be something that we need to educate people about and why it's, important this year, especially to get their flu vaccines done. And then we could get the information out that way, at least to the school, school families.
All right, does that cover everything, Lauren, for old business?
It does, yes.
Okay, on to new business. We do have an item listed for a discussion of chairperson.
Yeah. So,
Did we say we were going to put that on for I know we've been putting it off, discussing it, and
yeah, I just threw that on there because I figure we haven't really had a set person, and I know that it has come up, so I don't know if you guys want to decide now, you want to keep going as it is, it's totally up to you, but I just know that there's a different compensation schedule, and I just want to make sure it's fair for everyone. I don't know.
yeah, I know traditionally the board has always had a doctor on as chairperson. Not to say that it has to be that way, but I know that's kind of how we've always done it. And I don't know, Shelley, how you feel about it, or Sue. I mean,
yeah, I'm happy to do it but Sue, if you've had more experience than I have, but I'm happy to do it. And I know when I first joined, I was sort of like the late comer. So Jeff kind of picked it up until I got used to it, but I feel like it would be fine if I can take that over at any time.
I don't mind. I mean, I'm retired now, so I'm more available. So it's up to you, you know, but it's not, so I don't mind doing it because like I said, I'm more available now since I'm retired. But if we want to stick with tradition, that's okay too.
Well, I'm fine either way. I mean, I don't want to burden you either, Sue. Do you feel like that?
No, I mean, I'm talking with, especially with the contact tracing and stuff. That's a big issue going on right now, which has been taking on a lot of all the other public health issues. So I'm okay with it. You know, the one thing, we have a good team, you know, especially right now, I feel we complement each other. And I know that I've always felt that way, but I even more so now, you know, we all have different strengths and weaknesses. And I think one of the big things is, like I said, I'm more available right now than probably, you know, if you're in the middle of the day working, and same with Jeff, I mean, I am around more. So I have no problem doing it. And as I always know, if I get stuck or have trouble, I know that one of you will bail me out, you know, or step in and, you know, clarify or whatever, which we do now anyway. So.
Okay.
Yeah,
Well, if you,
yeah, so I almost feel like I'd, you know, leave it to you two in the sense that, I mean, I'm always happy to stand in and do it, which I've done in the interim, the last few chairpersons that we've had. But like I said, I think that, you know, we've traditionally had doctors do it. And Sue, I know you're very well qualified to do it and you have the time to do it. So I think, you know, I'd certainly go along with, if one of you wants to make a motion, you know, I would probably be in agreement on whatever the two of you wanted to decide in that respect.
well, I'm happy to make a motion for Sue to be the chair, but with the side promise that you let me know if you need help, or, you know, I know you have some health issues. I don't want you to put
Right.
at risk in any way. You just, you know, lift a finger and tell me you need help, and you've got it. So instantly.
And like I said, I mean, I think we all complement each other well. I mean, most of the stuff, if it's, you know, if Lauren needs something right away, she can call me. She can call any of us, but I'm probably easier getting a hold of right now. But a lot of times, like I'll say, you know, well, I think you need to throw it out to Shelley, or you need to throw it out to Jeff, you know, and get it done that way. So I think we're going to function in the same manner no matter what, you know, whoever is doing it. But I will definitely, I would definitely reach out. Yes.
Okay, well, I'll second your motion, Shelley, I guess, for Sue to be named chairperson. Do we have any further discussion on that? All in favor? Shelley?
Aye.
I'm in favor as well, I guess.
I'm in favor too.
Okay. All right.
You get a vote on your own.
Okay, so that's taken care of. Do we have any other new business, Lauren?
Just since the last time we spoke or we met, I know you guys have probably heard the Colonial Hotel was like a hot topic in the media. So basically, there were some events that took place there, and I'll start at the beginning. Starting like maybe mid-July, we started getting some different calls and emails and complaints from people that were reporting. They were alleging that there was going to be a large wedding at the establishment. And per the different reports we got, the guests were definitely going to be over 100 people. Also, the Department of Labor Standards did get some multiple reports alleging that there was going to be a large event that exceeded the governor's COVID safety guidelines as far as capacity. So we spoke to the Colonial a couple of times. So we gave verbal written warnings prior to the event occurring. And then after the weekend of the event, we received reports that events did in fact take place according to the report, and that there were over 100 people in attendance at events both on Saturday and Sunday. So basically just our office worked with the city law department and we took the legally appropriate steps after the event and we issued some fines, and the state, the Department of Labor Standards through the state issued fines as well. And they're currently handling the case. So we're kind of still currently in the appeal process period. So that's really all. I just kind of wanted to update you because obviously I know you're hearing things all over the place, and that's just like the official of like what happened. And that's all I got for new business.
Okay. All right. So nothing else for new business then?
Nope.
Okay.
I can just update you on a few things, just going, you know, there's a different contact tracer, that tracing situation that's from the state, and we did get notified by them that they've been contact tracing about with a group of people and family that relates back to Gardner with a house party. So I think even, you know, things are happening without us even knowing about it sometimes, and till it's like, it was a week later that they notified us. And
Because the people lived in another community, right? That's
yeah,
right.
some of them did, but you know, after there was a death and, you know, other people got, you know, contacted the virus, then it was related back to a house party up here in Gardner. So it's still trying to get that message out there. There's a lot of stuff going on that, you know, I can't really go through. This isn't the appropriate venue to discuss, but there's a lot of things going on out there that, I don't know, it's just trying to get that message out there to people still. But
Okay. Well, anything further on that, or did you have anything else, Sue, that you wanted to?
no, I think our clusters are pretty good. Most of our nursing homes are good. Testing is going well with Haywood. They've been great, and Tully. So testing's available for people, and there's not in the area. It's not a problem.
Okay. Well, I guess the last item is just for us to set the date for the next meeting. Did we want to go 2 weeks beyond the tattoo reg meeting and go to the 14th? Is that?
Yes, Monday, September 14th.
Does that work for everybody?
That would be fine. Around this time of 4:30.
Sounds good.
Sounds good.
All right.
Okay. Do we have a motion to adjourn?
Make a motion to adjourn.
I'll second it.
Okay. All in favor? Shelley?
Aye.
Susan?
Aye.
And I'm in favor as well. Meeting is adjourned.
Aye.
Bye.
Okay.
Thank
See you,
you.
everybody.
Bye-bye.